For our study, we chose to research intoeing. Intoeing, which is otherwise known as pigeon-toed, is a common reason as to why parents may bring their children to the podiatrist. Parents are often concerned about the child's gait pattern and its sometimes symptomatic nature. Often, an intoeing gait pattern is part of a variant in normal growth, but it sometimes can be a symptomatic gait pattern. Some of the symptoms experienced by an affected child includes clumsiness, frequent tripping, and fatigue-like pains. Long-term consequences of an intoed gait can involve patellofemoral pathology, abnormal subtalar joint pronation, and hip joint arthrosis and patellar instability.
From the article by Jones, Kandkar, and Tulesa, we can see the normal variance for intoeing caused by metatarsus adductus is present generally at 1 year of age, mainly in males, and in most cases resolves spontaneously, but in severe cases may require casting and/or surgery. Internal tibial torsion is present generally at 2 to 4 years in both males and females, and a tibial femoral osteotomy may be required if this deformity is present after 8 years of age. Femoral anti-inversion is present generally at 4 to 7 years of age in females, and also a tibial or femoral osteotomy may be required if this deformity is present after 8 years of age.
Many treatments have been proposed for intoeing, which include a brace, wedges, stretching, exercises, shoe modifications, and surgical procedures. For our PICO question, the population and the problem was paediatric patients with an intoeing gait. The intervention was insoles involving gait plates or orthoses, and the comparative treatment was surgery. The outcome that we were looking at was the effect of these treatments in reducing the intoed gait. The question we have composed is, are insoles which involve orthoses and gait plates effective at reducing intoeing in paediatric patients compared with surgery? To acquire information for this assignment, a variety of databases were used. The first database that we used to acquire our article was PubMed. Once logged into the PubMed database, Advanced Search was clicked. In Advanced Search, intoeing was put into the first search bar and builder, and in the second search bar, treatment was entered. This came up with the search heading of intoeing and treatment in the main search bar at the top of the page. After clicking search with these terms, 48 items were found. To narrow our search further, a date range from the last 10 years was selected as a filter. This then showed 28 results. From these results, an article was handpicked that best matched our PICO question. The article that was handpicked was called Orthotic Devices with Out-Toeing Wedge as Treatment for Intoed Gait in Children. Our next search was on the Medline database. Once logged into the Medline database, intoeing was typed into the search bar and search was clicked. On the next page, intoeing was selected to be searched as a keyword. From this, 21 results were found. To narrow the search further and to find higher quality articles, publication type was used. The publication type selected was controlled clinical trial. This was selected as it was the highest level of evidence that could be selected with this search. After selecting controlled clinical trial, one article was found and it matched our PICO question, so this one was selected to be used in our study. The article was called The Effectiveness of Gait Plates in Controlling Intoeing Symptoms in Young Children.
For our next journal, we used Medline using specific keywords, intoeing and surgical management, which came up with 52 different results. To narrow down the search, I clicked on Advanced Search in the first box. This brought up the article, Surgical Management of Persistent Intoeing Gait Due to Increased Internal Tibial Torsion in Children. The search was quick and easy when using specific key terms.
The studies that we were able to find for our insoles part of our report were not systematic reviews or randomized controlled trials, so therefore we needed to find other appraisal tools to appraise our articles. We found the Critical Appraisal Skills Program Cohort Study Checklist to appraise our first article. The level of evidence of the study by Redmond 2000 was classified as Level 4 on the National Health and Medical Research Council Levels of Evidence Hierarchy. The checklist used to appraise this article can be used to appraise cohort studies. 12 questions are part of the checklist, which can be seen on the slide. The questions help us identify how well the study has been undertaken, define the results, and think about whether we think the results are good enough that they can be applied to the local population. Redmond's article produced favourable results, however, confounding factors weren't identified or taken into account. The article by Manura, Castillo, Dominguez and Lafuente 2010 was appraised using the McMaster Critical Review Form for Quantitative Studies. This study is classified as Level 3 on the NHMRC Levels of Evidence hierarchy, as it is a comparative study without concurrent controls. The appraisal tool used to appraise this article helped us to identify the significance of the results obtained and if the outcome measures were reliable. As seen in the table, the study purpose was stated clearly, background literature was reviewed to determine if there was a need for this study, and outcome measures were reliable and the results were statistically significant.
The retrospective case series journal by Davids, Davis, Jonathan, Westbury and Harden is classified as a Level 4 study according to NHMRC. It was appraised using the Critical Appraisal Skills Program. This appraisal tool helped us to see that the journal clearly states the focused issue, has precise results, which can be applied to a specific population. Although the study does not contain controls or blinding of subjects which may cause bias, therefore further studies with a larger population group may be required.
Redmond 2000 performed a study that looked at the effectiveness of gait plates in controlling intoeing symptoms in young children. The gait plates were investigated for their effectiveness at reducing the amount of transverse plane pathology and symptomology associated with an intoed gait. The gait plates used in this study were contoured, moulded plates and were not posted to neutral at the rear foot or forefoot. An example of a gait plate can be seen in Image 1. The measurements made through the study were made with the child wearing standard, lightweight, flexible-soled canvas athletic shoes that were provided by the author. The first questionnaire was administered upon admission to the study before the intervention had been applied. A second questionnaire was administered 1 month after the intervention had been applied. The parents of the participants were the ones answering the questions. The 18 participants were aged between 18 months and 5 years, demonstrated only postural abnormalities with no neurological abnormality, experiencing symptoms associated with the intoeing, and demonstrating an intoeing angle of greater than 3 degrees, which is 2 standard deviations from the normal population mean. After wearing the gait plates for 1 month, there was a small but statistically significant improvement of median foot placement angle of 6 degrees. It is important to note that the improvement in the median foot placement angle can only be considered with clinical importance if it is accompanied by an improvement in the symptoms associated with the intoed gait. The questionnaires explored the improvement in symptoms further. The responses in the questionnaires were favourable and improvements were seen in rate of tripping and the overall satisfaction of the parents who thought the gait plate therapy was worthwhile. The improvement in objective data of foot placement angle and rate of tripping, as well as the high satisfaction rate of the gait plates, warrants further research into gait plates and their effectiveness at reducing symptoms of intoeing in children. The cost of a gait plate is relatively inexpensive, but it is important to ensure that it is the right treatment for the patient, otherwise it will have little effect. For example, if the intoeing is occurring at the hip, gait plate will do very little to reduce the amount of intoeing occurring. No adverse effects have been reported with gait plates, but it is also important to consider possible adverse effects such as blisters from the gait plate coming into contact with the foot and general discomfort from the gait plate. The article that was found using the PubMed database was one written by Manura, Castillo, Dominguez and Lafuente 2010. This article focused on the use of orthotic devices with out-toeing wedge as treatment for children who have an intoed gait. The study looked at the effect of an orthotic with an out-toeing wedge alongside a physiologic shoe to treat an intoed gait. This study was performed on children aged 3 to 14 and there were 48 participants. The angle of gait was measured for all of the participants and the way in which this was measured can be seen in Image 2. Angle of gait was compared between the different groups which were unshod, shod without treatment and shod with orthoses. The aim of the orthotic device in the study was to help children progressively acquire a more physiologic walking pattern. The orthotic device used has an out-toeing wedge that consists of a distal extension of the material of the orthotic device that selectively overshoots the metatarsophalangeal articular line of the external rays and ends in a point in the subdigital space of the fifth toe. The device can be seen in image 3. This device is similar to a gate plate, but it is combined with a custom-made functional orthosis. The orthotic devices were made from semi-rigid 3mm thick polypropylene. During this study, the authors also looked at whether a physiologic shoe that is correctly fitting and sensible styled could also alter the angle of gait itself. The results of this study were favourable and most were statistically significant. The angle of gait was increased in a non-significant manner by using a correctly fitting shoe. The statistically significant results are as follows. Angle of gait was increased in children with orthotic treatment in correctly fitting shoes. Reduction in intoeing of 5.3 degrees was seen between unshod and shod plus orthotic. There was a reduction in intoeing of 3.6 degrees between shod and shod with treatment. Similar to the previous study, the cost is relatively inexpensive for the orthotic device. However, it is important to consider this is the right treatment for the child. If it isn't, it is a pointless expense. The availability isn't high for the devices in this study as they are all custom made. And the adverse effects are similar to the previous study as well, as they may cause blistering and discomfort and need to be worn in properly.
Davids et al. Looked at surgical management of intoeing due to increased internal tibial torsion in children. This study was a retrospective case series. The study took 1.2 years from pre-operative analysis to the post-operative follow-up appointment. The final study group consisted of 28 normal developing children with a mean age of 10.2 at the stage of the surgery. These children suffered from symptomatic intoeing gait. They were treated by isolated tibial rotation osteotomy. According to the journal, there was no funding in the study and cost was not stated. The surgery was performed by 2 surgeons who used the same techniques and post-operative procedures and management. The surgery involved placing a Steinmann pin into the tibia as proximal to the plate, aligned with the flexion-extension axis of the knee. The second pin was placed into the tibia distal to the plate, aligned with the long axis of the foot. The osteotomy was performed at a level between the pins, and the distal tibial fragment was rotated externally until the pins were parallel, aligning the knee and ankle axis. Fixation of the tibial osteotomy was performed with a compression plate. There were no complications during or post-surgery. All incisions made during the surgery healed, and no reported adverse effects were stated post-op. Adverse effects could include infection, increased pain, or decreased mobility. Overall, there was great patient satisfaction. Some noted improvements at the follow-up appointment included tripping decreased from 18 out of 28 children pre-op to 1 out of 28 post-op. Falling decreased from 11 out of 28 children pre-op to 0 out of 28 post-op. Foot and ankle pain decreased from 11 out of 28 pre-op to 2 out of